The Gift of the Givers has also stepped in to assist in that situation. You would know that some of these students are going to need some clothes and food as well. The director of that organization, Dr. Imtiaz Sooliman, joins us now live. Dr. Sooliman, a very good evening to you. Thanks indeed for your time. I think many South Africans are commending you for the work that you're doing out in Cape Town while this fire continues to rage there. How many people, students, firefighters, are you assisting with food supplies?
Good evening to you. The students from the university count has been 4,000 and the firefighters have been 160. And of course the firefighters do rotate, so it could be around 200. We're not sure, but wherever we go, there should be around 160 firefighters. The student count too, it varies, it changes all the time. The university has still been sorting out the list. And initially we thought it was only 8 or 9 hotels. We now know they're housed in 29 hotels. And last night we provided 4,000 meals for the students. In fact, at some point, the meals ran short because it reached out in good portions, and we had to go and get additional 555 meals, which we arranged late at night. But the students were very patient, they were very calm, they were very grateful. So, and then as the man mentioned about toiletries, when we got to the hotel, they said, look, we're sorry to trouble, but we need a soap, a toothbrush, and a toothpaste. We've packaged all those items today, and it'll be being delivered to them this evening.
That's quite a lot, Dr. Sooliman. I mean, how much is this costing you a day? These are over 4,000 people. If you look at students, that's just 4,000. And those numbers could escalate while those lists continue to be compiled.
Well, it's 4,000 3 times a day from today. When we spoke to the university on yesterday, they asked us to provide 4,000 meals. And they came back to us and they said, can you make it 4,000 3 times a day? And it's 12,000 meals per day, plus the firefighters and, the hygiene practice. So it's a substantial amount of money. But fortunately, we've got our reserves and the public has been very, very good. The corporate has been very good. People have come forward and I think we will be fine to survive the next 6 or 7 days or even longer.
I guess for anyone who's trying to assist in the situation there, the hotels have come on board. Corporates, as you say, have also chipped in to try and assist. What is it that you need as the Gift of the Givers at this point to try and assist the students as well as the firefighters who are clearly going to be out there for a very long time?
There's 3 categories. One is food. Secondly is drinks. And thirdly is hygiene items, which the students have mentioned. So food itself, we have the breakfast, the lunch and the supper, and there's different types. The breakfast is more cereals, eggs, sausages, bolognas, juices, yogurts. Lunchtime, sometimes it's just a Wars roll and coffee with it. And then the supper is the big one, where we have different types of meals, chicken meal, fish meal, beans meal, mutton meal. We have to cater for the different tastes, and so those who are vegetarian, for that halal, and those who don't eat strong food. So it's very, like last night, we had to make 3 different types of meals for the first night. So far, the students seem to be fine. The UCT Council sits with us, well, members of the council sit with us, and like today was the first day post the first feeding, where we sit and design the menu together, and to send out the breakfast this morning, lunch this afternoon, supper for this evening, and immediately after the supper, we sit and plan for tomorrow's distribution. So the food that the students get, the firefighters will get the same food. The water, the drinks, the snacks, the energy bars that the students get, the firefighters will get, except that the students will, in addition, get the hygiene items which they requested.
Those are huge numbers. Are you also getting assistance in terms of hands? One of my colleagues, Corbin August, was at one of the hotels where the students have this temporary accommodation. In terms of hands, do you have enough hands on the ground to assist with this kind of distribution?
Cape Town has been incredible. If we didn't stop the people of Cape Town, we'll have more volunteers than students that need help. So we had to tell them, please, we don't need so many people. They've just been overwhelming, the amount of people that have come forward. Last night, we had an orthopedic surgeon and a pediatrician dishing out from the pot, putting into the foam boxes. And there were emergency medicine specialists and other doctors who came. Today, again, there's a whole lot of doctors and old people, young people from all walks of society. And so many people have called in, and we are extremely thankful. Thank you very much, everyone. But it becomes a problem of social distancing and making sure that there's not so many people around. You don't want to create a super spreader event, but COVID is not gone yet. So we have to take the precaution, but we are extremely grateful for the numbers of people that want to assist.
The director of Gift of the Givers, Dr. Imtiaz Sooliman, thank you very much. And I think I would speak on behalf of all South Africans, especially for the work that you're doing out there in Cape Town. Thanks indeed for joining us on the program.